Hello, thank you for joining us today. My name is Dr. Kerry Yerkew, and today we're talking about the TMJ and jaw pain. I've been in practice for over 26 years now, and I've treated many cases of TMJ uh, and probably hundreds of cases of TMJ now. And I was a guest speaker at the South Okanagan Dental Association. The dentist invited me to speak to them to provide a different approach to their approach for TMJ. So I'm going to share that with you today. And now I'm practicing in Kelowna, British Columbia. So TMJ and jaw pain. TMJ stands for temporomandibular joint pain. Just a disclaimer, if you have TMJ or jaw pain, I encourage you to get that assessed by a health professional in your area and one that can recommend the proper care for you and follow up and give you recommendations for your specific problem. Today, I'm just going to share with you what I've seen in the clinic and the treatments that I've done to help people. TMJ stands for temporomandibular joint, and that's the jaw joint. There's two joints, one on the left side, one on the right side, and it's a sliding hinge joint connecting your jawbone to the skull. You have one joint on each side, and TMJ disorders are a type of temporomandibular disorder, or TMD, and it can cause pain in your jaw joint and the muscles that control the jaw movement, the masseter muscles that are in the cheek area. The alignment and function are important to us as chiropractors, and it's a different approach from the dental approach. We look at the alignment of the jaw and the function of the jaw, and we take the posture of the head and neck area into consideration when we assess the jaw as well. For the jaw joint, it's composed of the mandible, which is the jaw itself, and then the temporal bone, which is the large bone on the side of your head. And the joint is composed of that mandible coming into the temporal bone, forming a condyle like this. In the condyle, there's a disc that protects the bones from rubbing together, and the disc will move as the jaw is open because it's attached to a ligament, and that just protects the jaw bone from rubbing against the adjacent bone in the joint. For symptoms, there's a number of different symptoms that TMD can cause, but the main ones are pain and tenderness in the jaw, pain in one or more of the temporomandibular joints, aching pain in and around the ear, difficulty chewing or pain while chewing, aching facial pain in the muscles in the face region, locking of the joint, making it difficult to open and close the mouth, and then clicking of the joint. So I've seen all of those symptoms in the clinic. For posture, we do assess the person's posture. If they have a rounded posture like this, and a lot of people, or more and more people are getting this type of posture because of text neck, it changes the alignment of the jaw joint. And now when the jaw is closing in the condyle, it's now closing differently, and that can cause some problems in the jaw. So if we're going to treat the jaw properly and resolve the issues, we want to work on the posture as well. So we assess the head and neck region, we assess the angle of the jaw joint, the muscular function in the head and neck area, and then the way the disc is working. So what can we do? How do we assess the TMJ? What can be done for the pain, and how can we realign the joint? How do we balance the muscle function as well as get good long-term results so it doesn't come back again? Well, we do an examination, and to do the exam, we need a history. We want to know how far back this goes. Was there any trauma, injury? What are some of the related symptoms? What are some of the stresses on the joint? And then we'll do an examination to determine the alignment of the jaw, the function of the jaw, and the alignment of the head and neck region. We will take x-rays if necessary. X-rays help us to determine if there's any pathology, but x-rays also help to determine things like osteoarthritis that might be present in the joint. Diagnosis, The diagnosis is for TMJ or TMD is sprain or strain. Could be a disc issue in the jaw. There could be postural changes, arthritis, primarily osteoarthritis, and there could be some dental issues as well with the teeth themselves. For treatment, we do manual treatments to the joint and instrument treatments to the joint. And so the manual treatment will involve the patient opening their mouth or letting it go loose, and then either by hand or using an instrument, adjusting the jaw. It's actually quite a gentle procedure to realign the joint. Sometimes it takes a few sessions to train the jaw to work properly, to reestablish the proper alignment and the function. We will give stretches and exercises so it supports the treatment we're doing in the clinic, and we will assess the person's posture and alignment and give them some postural tips and alignment tips so that they can help to get a good long-term outcome. We will recommend ice or heat. I am very cautious recommending ice in particular in this area because some of the nerves are more superficial in the facial region, like cranial nerve 5. And so we want to be really careful of the recommendations for ice. Generally, I tell people to use a towel, and then they can put the ice in a towel and just to use it for a limited amount of time, maybe 5 minutes, if there's been a recent trauma or it's a new condition. If it's an older condition, it's chronic, been there a long time, generally I defer go to heat, and heat doesn't have the same concerns. I still tell people to put a wet towel around a hot water bottle as an example, but I don't, but I'm not as concerned about using heat as I am with the ice. For lifestyle, we take everything into account. So the food the person eats, the stress levels they have, their nutrition and exercise, because all of those factors can play into the TMD disorder. For stress, we'll recommend that people reduce the stress levels, reduce the cortisol and inflammation in the body to help the joints to heal. And in particular with stress, we find during sleep, people will be clenching or grinding and then overworking the joint and the muscles. For jaw exercises, some of the exercises we prescribe are opening and closing, side to side or lateral movements. And we want to stretch the ligaments and muscles in the jaw and the head and neck region as well. For nutrition, we recommend soft and easy foods. Eats the foods that you can easily digest, sometimes just liquids at the beginning. And we want to make sure the diet is rich in anti-inflammatory foods that will help to the body to heal better and the joint to heal better. I wouldn't recommend nuts or almonds at the beginning, but green leafy vegetables, soft fish, mackerel, tuna, in particular, if it's in a can or if it's been mixed with some mayonnaise or something like that. And fruits, softer fruits like strawberries or blueberries are better. And then turmeric, it's a spice that does have some anti-inflammatory properties. For sleep, that's very important during the healing process. It helps to reset the body's rhythm, the circadian rhythm. It helps reset the chemistry. It calms the body, allowing it to heal. And so a lot of the healing process happens when you're at rest or when your body's very calm. Yoga is a great exercise to do, and it relaxes the body. It works within the body's limits and increases flexibility. And so yoga is a great thing to do, and joining a class or an online class is wonderful, not just for the muscles and tissues, but just that mind-body connection and relaxing the body. If you have jaw pain and you're in the Kelowna area, please call our office, and we are currently accepting new patients. It's 250-486-0062. I did write a book on back pain, and I did write a book on neck pain. They're both on Amazon. You just have to type in back pain and my name, and then you'll see the 3 formats, and that's ebook, paperback, and audiobook. So both books are available in the 3 formats. We do have a number of webinars we do, and we post them on Eventbrite. And so if you go to our Eventbrite page and then type in Dr. Carey Yurkiw Chiropractic, you're going to see the upcoming events that we're putting on different topics like back pain or joint pain or arthritis. I think we've done 20 to 30 webinars this year, and most, if not all of them, are recorded and uploaded to YouTube or our podcast channel after. We're located on Dixon Avenue, where the tall glass towers are in Kelowna. My email address, drcareyyurkiw@gmail.com. If you have any questions, don't hesitate to send an email. I'd be happy to answer that. We're offering people in the Kelowna area a free 15-minute consultation if you want to find out if chiropractic can help you. And it's by appointment only. Call or message us at 250-486-0062. This offer expires on November 18th. I want to thank you for joining us today, and I look forward to seeing you at a future webinar or in our clinic as a new patient.